Good afternoon, everyone. Hope you're good. I'm not feeling yet brave enough to consistently use the intro videos and music yet because we've had a few glitches recently, including, I think Leanne had some problems yesterday doing her guest hosted show. But thanks again to Leanne for hosting on every second Tuesday of every month. She's bringing you all sorts of goodies at the moment, and I know she's got more planned, so thanks to her. But yeah, we're just not braving the intro music, which blares out into your ears anyway, and many of you complain anyway, so we're going all gentle, and I'm coming in as this instead. Now, today we've got a great show planned. Ben Wilkins is joining me for what is now a monthly feature. My favourite thinker in the direction of MSK Public Health. I mean, public health generally, he's a true oracle, but also with that MSK background, he can really help to translate it for us lot. And so he's joining me, but also I've got Andrew Power, who's from Swim England. And we've got some great news in that direction, which really nicely follows on from last month's episode. So this is our public health newscast once a month. We're going to be doing topics like this, which are really important to bring forward. Thanks as ever for those of you participating through the weeks in the chat. Don't be shy to join in. I know what you like when we've got guests on, especially new ones. You keep it quiet till the end. So please bring your questions forward and get them in the chat, regardless of where it is you're listening to this. And we will endeavour to get to those. And if we don't, then they will no doubt set the scene for future episodes of this kind. So without further ado, let's see if I can bring in Andrew and Ben. Can you hear me, gents?
Afternoon, Jack.
Look at that. It's obscuring my face. That's terrible. Although the audience would probably prefer that. Let's just hide my little frame there for a second. Let's make some adjustments. Right. So I want to get stuck straight in then. Ben, you've made some great suggestions as ever, and an esteemed guest that you've brought along. But what I want to always ask is, what are we starting with and why? That's the why question's important.
So what we're starting with today, so we're going to look at social prescribing because it's Social Prescribing Day on the 12th of March and it's International Social Prescribing Day on the 18th of March. And this completely links into what we talked about last month about how are we going to deal with the backlog of MSK patients and challenges in the wake of COVID, and how we need to look at the community, and also with Sport England's new strategy focusing on health and wellbeing. How social prescriber is a great connection with that, and Swim England's on the call as well, fronted by Andrew today, to kind of bring forward one of the national governing bodies of sport to see what they're doing to align with both Sport England's new strategy around health and wellbeing and how that links into social prescribing.
Fantastic. No, that should flow really nicely. Andrew, could you just introduce yourself for the listeners, for those that don't know your work?
Yeah, sure. Andrew Power. So I'm a water wellbeing specialist at Swim England. So I'm part of the overall organisation at Swim England who are responsible for swimming, diving, artistic swimming, water polo even. But we have a real broad vision around encouraging and getting a nation swimming and involved in water. And when I say swimming, I refer to aquatic activity at the same time, in the same breath. Sure. We tend to use swimming as the catch-all, so just so you know.
Being in water, right? No, but that aquatic activity I like. That's good. Ben, so I think one of the things that we hear banded around a lot as jargon sometimes is social prescribing, and I'm not saying that that's therefore inherently a bad thing that it's banded around. I think it's good. It's become more part of the vernacular, but also sometimes that because these things can sometimes become a buzzword that aren't always understood. So, what is social prescribing, and how does that apply within MSK?
Yeah, so social prescribing is part of the NHS long-term plan, and what social prescribing is looking at how the activities that are offered within the community can be linked to patients that will benefit from them. So what the social prescribing model looks like is where health professionals, whether it's GPs, physios, will refer patients into the community to see a link worker or a social prescriber, and to have the time to ask the questions such as what matters and what matters to me and my health condition. And so it's that time for an individual to focus what are the opportunities in the local community that will be beneficial to them, whether that's things such as walking groups, coffee meetup spaces, swimming, exercise, gardening. There's all sorts available that we know have a positive therapeutic impact on people and part of their own self-management, but it's about having that support to navigate the opportunities that are right for that individual.
No, it's interesting. And with regards to social prescribing, both in terms of its broad concepts, Andrew, but also its application within, say, swimming. That's something that is a classic one whereby we would try to indicate that people should be engaging with these things, not necessarily as a specific medicine, but instead as an intervention that's more broad. Is that something that Swim England are involved in and aware of?
Yeah, absolutely. I mean, we've worked for the last couple of years. We've worked on developing system-wide approaches to supporting people to use water and to use our pools and open spaces as well. We're responsible for open water swimming as well. So we've done a lot of work in terms of looking at the individual pathways. We've worked with Good Boost and with Ben in terms of that being an individual pathway for people to follow, specific to MSK issues as well. But we've have existing pathways already in place, like the Learn to Swim program, for instance. How do people access Learn to Swim programs, particularly if they may have other barriers and limitations? So we've worked for a number of years in terms of developing a model and a systems sort of approach, a pathway to get people to the point where they can succeed and really achieve what they need to achieve in terms of outcomes via a number of different approaches. And that could be inclusivity and access. There could be issues around access to pool spaces. There could be professional perceptions or misconceptions that cause that end up being a barrier as well. And then just programming and opportunity, pathways that need to exist to facilitate and allow that journey to complete and get people into the pools.
Of course. And now one of the things on that you've just reminded me of, I've been thinking about for a while, is that accessibility is an interesting one with how that plays with open water, because I feel like that has proliferated in recent years. And I don't know if that's me attending to that more or whether that is the case. I mean, I'm sure I'm not going to ask you to suddenly pull the data without me having prompted it before it. But I'm just wondering, is that the case? Has it proliferated? And if so, does that improve? I can imagine reasons why it would improve access, but also that there's a different barrier to entry in terms of people being worried about the cold, relative to pools. And so I just wondered how that's played out with you guys.
Well, absolutely. I think open water swimming as well, and just access to open water is definitely soared, and particularly during the pandemic as well. Sure. But not just during the pandemic. Prior to that, I think there's always a bit of a trade-off in terms of participation figures around swimming, and where those individuals are actually participating in terms of data that we get from Sport England, Active Live survey data, and other data sources as well. So I think it's somewhere in the region of 2.25 million people who've accessed, open water. But that could be on holiday. It might not necessarily be a weekly occurrence. It might be something that happens less frequent than that. But there's a significant chunk of the population who are accessing open water, and also I think there's probably a bit of an overlap between that, between those numbers who also use pools as well. Swimming outdoors, but swimming open water, but also swimming outdoor pools or indoor pools, and sort of mix it up.
It's a great point. Ben, one of the things I think we probably benefit from being a bit more confident with as MSK professionals is probably, as we're broaching this social prescribing role and recognizing that as being beneficial, I feel like I can recognize that I'd probably err on the side of caution and be recommending pool swimming and the like rather than open water. We're not particularly coastal where I'm at now, but that's certainly another variable again, isn't it, with regards to that? So I suppose that's where the right parameters being put around these things is going to only improve professional confidence and also knowledge of the safety parameters around that, and what support is available for Swim England and others is only going to help in that direction.
Definitely, and that's the role of social prescribers and link workers, to identify what is the right opportunity, and for social prescribers to be updated and informed by national and governing bodies like Swim England, and what's the guidance for different health conditions, and what's recommended for their local area in terms of indoors or potentially outdoors if it's appropriate. But it's the social prescriber that those link workers are utterly key to the success of the social prescribing program, because it's designing something around them. It's not just there's a message board and there's a load of leaflets and is pick and mix to hope that someone picks the right one for them. It's having the time with that social prescriber to make sure it's right for them, right for their condition, but something they'll enjoy, because we know from behavior change there's no point giving someone a GP referral program to go into a leisure centre when it's not something they want to do anyway, when actually they'd be better off gardening and a tiny bit of digging to be active, maybe something they engage with long term rather than a short term one-off session.
Yeah, absolutely. Well, I actually think that dare to dream, and the more people think like this, the more we will be able to prescribe allotments to people, and that will be a fun one. Now, when it comes to the disruptions, as we've talked about on other shows, Ben, and we've obviously covered in various different angles on this show without you, is the COVID situation has been so disruptive, but it's also meant that the ability, we've kind of, just as we'd started to decentralize a little bit with regards to healthcare, a lot of those avenues literally got cut off, including many that you're both involved in. What's been the impact, and how can clinicians overcome that?
Yeah, so part of my understanding of social prescribing is I sit as a trustee on Merton Health Watch. Merton's a borough in southwest London who run one of the first social prescribing programs, and so been very much seeing what's happening during COVID for the social prescribers. A team that's led by Bev and Dr. Miriam Seacombe. Got recognised this last year for winning awards as well, but they've completely shifted, of course, to a lot of clinicians into telehealth support with social prescribing, what digital options are available for people when it hasn't been possible for people to attend in-person support, in-person classes. So social prescription's still going on. It's adapted like every clinician to the pandemic, but you're right, Jack. I think because of the challenges that health is facing, and particularly things like MSK, mental health, and the prevalence of people who are dealing with this is far greater than the number of clinicians to solve the problem. Social prescribing is placed in the perfect position. There is a chance, just like all other NHS services, that there is too much of a challenge for it to deal with it successfully. There's no doubt, but adding additional options into the mix means that there's a better chance of us supporting more people to return back to health and well-being than it would have been without social prescribing.
Of course. Now, for those that I'm going to bring the audience in where possible to say, what do you know of social prescribing, and what engagement have you had with it so far? Is it something that you wanted to see in your future? Because that comes to my next question. Just come in as you were going to, Andrew, if you would, but also if you can touch on what you feel the future of social prescribing should be.
Yeah, and it's just touching on what Ben said there. I mean, the Sport England strategy has been really, really clear, and the ambition is that, we've got to work, we've got to start to focus our efforts and target those who are, I think the term was, I'm trying to figure out where, pull it out the sky somewhere, but it was, I think, those that were had the most to gain are least likely to participate, and that's exactly where social prescribing really comes into its own, is that we've got individuals who probably would participate, but there are too many other things, not just lifestyle issues, but societal issues and personal issues that they have that act as those barriers that stop them even getting to the thought process of starting to think about going swimming or going, or becoming more active. And I think that's one of the things, that the Sport England strategy outlined is that we've got to be targeting those individuals who have the most to gain by making those changes, who often have the greatest number of barriers as well, and that's why they haven't engaged in the past. So, I mean, I'm gathering case studies at the minute in terms of just providing some examples to the swimming operator community and the workforces out there to explain sort of the concepts of social prescribing and what that can really mean to individuals. And we've got examples of individuals who just, for different reasons, for mental health reasons, just depression, anxiety issues, wouldn't make that first step to go to the local pool. I think we had one example of a lady who just felt that the biggest barrier to her was that she'd been so inactive for so long, and she had issues around, body conscious issues, really worried about getting into the pool for the first time and didn't have a costume that she felt was appropriate that she could wear. And the social prescriber went shopping with her and took her through, led her through that process that caused her the greatest distress. Got the bit of the key bit of equipment that she needed, i.e. an appropriate swimming costume, which she felt comfortable in. And she was back into swimming immediately after that. So, and I've worked on health trainer models, early career, sort of the development of the health trainer competencies. And what social prescribing's done is say, hey, there's so many other issues here than just diet, nutrition, smoking, physical activity that we need to address in individuals. And let's take a wider look at that and a broader approach. And I think Sport England's strategy, what we're trying to do in Swim England as well, is take that broader outlook on things and look at the other issues that are preventing people from doing these things in the first place. Because we've got a lot of good offers at the end of the continuum. There's lots of things available to people to help them, but it's getting them through that door for the first time that's the biggest barrier.
And also getting the partly the new and novel workforce, the social prescribers, to actually be able to help bridge that gap, but also then training an existing workforce to start to engage with that more. It's sort of a balance, really. And certainly thanks. Joe Turner has posted that she loves the idea of prescribing allotments. I wonder if that maybe brings me to ask Ben, what do you think is the future of social prescribing your end?
The future of social prescribing is exactly what Andrew said, is that the barriers that currently exist, so people don't start thinking about it, aren't aware of it, won't take the first step engaging, are removed. So many of the solutions, as Andrew rightly says, are already out there. The options are there, the classes are there, the groups are there, the sessions are there. It's just that first step is really scary, particularly if it's your first time going into a leisure centre, it's your first time seeing a swimming pool since you're at school. It's the first time that maybe you've been outside, and because you've been so isolated for weeks to months, and actually having those first conversations, just to kind of what's the weather like and how are you doing, is incredibly scary. I think we forget that at school it's completely normal for us to have loads of conversations with lots of different people every single day. At work, that's a very normal thing. If you're out of work or you're retired or anything like that, that isn't normal, and actually we get out of practice. So the future of social prescribing is overcoming those barriers so that people can access these options confidently, regularly. And the future beyond that is, as the UK, we've been one of the leads in social prescribing, and kind of countries as well, like the Netherlands have taken it up, but the NHS, World Health Innovation Summit, the UN, they're now putting together the Global Social Prescribing Alliance to take the learnings, to take what's done really well, and to share that and scale that internationally. So I think the future is that this becomes something that's blueprint and standardized globally as well.
Yeah, I think that's exciting for me, especially as the world opens back up and we're all craving social activity. The fact that then as well, it coincides with an agenda of which we want to try to understand how to appropriately decentralize medicine, not just for the other benefits that we've known for years, but also the contagion risks that can occur for COVID and other pathogens. The realizing that there is infrastructure, community-based infrastructure and social prescribing networks that would stand us in better stead if, God forbid, this happens again, or equivalent or worse. Joe Turner's asked, is there a kind of process in place to help people overcome these barriers, or those barriers described?
I think it's the social prescribers. They go through a huge amount of training and development to become a social prescriber or a link worker in the first place. Motivational interviewing, kind of how to implement behavior change strategies, all these things. And that's the process. There is a step by step. The greatest part for social prescribers is they have that bit of extra time. They can have those conversations. They can think about approaching a problem in ways that a frontline clinician just never could, because time pressures are so limited. As Andrew gave the example of going shopping with someone to find a swimming costume that was right, to give them that support into the next. So that's the process. It's understanding about what that motivational interviewing is and what is the true problem. It's not that person didn't want to go swimming. It was a self-consciousness and not finding the right.
Yeah.
And so as clinicians, we go, well, you just don't want to be physically active. Well, no, the problem is actually a sidestep to that to get you towards being physically
active. It's non-compliance. It gets marked up on the notes, doesn't it? Now, I want to get stuck in, especially while we've got you here, Andrew, get stuck into the Swim England stuff in a little more detail. In the last show me and Ben did together, we talked about Sport England's new strategies. How is Swim England stepping up to that new plate?
Yeah, I mean, as I've explained, we've already been doing significant work for the last few years. I mean, we started off with some exploratory work, so probably going back 4 or 5 years now in terms of GP referral and swimming and the opportunities that existed there. We delivered a program around dementia friendly swimming as well, which is a bit of a game changer in terms of giving direction for the future and how we make swimming more appropriate and accessible for people with health conditions. So that had a pure focus on dementia, but we learned an awful lot from that that we've been able to apply into our current model, which is the water wellbeing model. And that program drew on a lot of the insight and research that we've done over the years. We commissioned a bit of work in 2017, the Health and Wellbeing Benefits of Swimming report, and that was essentially a review of the evidence, the available evidence. A number of institutions, Nottingham University, King's College London, Wolverhampton, Loughborough, Brunel universities all led on a specific theme within that report. Right. We looked at the physical health benefits, the well-being benefits, the physiological benefits, benefits to communities, public health as well. And each of the sections in there, I believe also we focused on swimming as a sport and the health and wellbeing benefits that come from sport alone and participation in competitive sport, and the economic evidence as well, which led to 2019. We did a bit of work called The Value of Swimming report. It had a ministerial launch, and that was very much building on that evidence that we had to date, but actually being able to quantify some of the impacts in terms of the healthcare savings to healthcare, to the NHS, social care, and so on, the significant benefit and impact that swimming can have. So we've kind of built on that evidence and built layer upon layer to the point where we are today, where we have a multi-component model which looks at things from, I use the term a lot, sort of car park to pool. So it's not about just what happens in the facilities, but what happens not just even in the car park, but what happens before that. And we know that salience is an issue with healthcare professionals. Right. And I can understand that. I've worked in primary care settings and secondary care settings early in career as well. And we have a lot on our plates. We have a lot to think about when we're working with individuals. You're working with a patient and everything that needs to be addressed with that individual. And then in addition to that, we've got to think about what do we do after this process and what do they do next. And I think that's where social prescribing helps and supports professionals to be able to dig deeper into individuals' thinking in terms of what the real barriers are to them. Why is it that they're saying that they can't be active or they can't go swimming, and what are the reasons behind that? So yes, we've done a lot of work to this point in terms of, which is in support of that strategy. I think Sport England have talked about systems-wide approaches. And that it is just more about, it's more about what we offer on that, flashy campaign or sort of glossy leaflet or flyer or membership information for our facility. It's more about that and more about getting into the mindset of individuals, but also the professionals as well. And we're doing a bit of work in terms of health education as well, and just raising awareness and that salience around swimming as an activity. Probably due to lockdown, we probably suffered a little bit in terms of the availability of facilities obviously not being open, and so swimming not being available as much as walking would be, or cycling or running or other forms of activity would be readily available to people. I think what we've got a bit of work to do now is to remind people that pools are about to open here, and there are some real benefits and to getting people into the water that can't be had on land in some cases as well. So.
Definitely. No, it's interesting. And I think as well, there's so many, the swimming as a social phenomenon is very interesting because of the way in which, especially in this country, people have sometimes had to engage with it through school, and therefore sometimes it can be a real marmite of an activity. Whereas as people get older, they come to realise that the benefits, of course, are lifelong, but sometimes that can change even the most ardent skeptic's mind as they start to recognise its health benefits, especially in the MSK game. We've got a couple of comments coming. I just want to read out. Thank you for the participation from Nick and from Paula. Local experience: inviting a link worker to come and talk to your MSK team is useful to build relationships and understanding of each other's roles. Absolutely, as ever, you know, these barriers fall away when we make those leaps and just invite that conversation. You know, stop making assumptions and start asking the questions. Paula Clayton's then added to that and said, informed facilitator can not only help team members understand the individual roles, but also how to optimize those relationships to maximize best practice. Absolutely agree. And I think that that's something that as the world opens up, I know I keep saying this, but we've got to try and make these landmark moments, these watershed moments whereby we take the opportunities as well as the challenges that have come from the pandemic and use the opening up as a true opening up of new ways of working. I know it's been said over and over, but that, you know, what our new version of the new normal can be in this social prescribing space is going to be up to us as professionals to reach out, provide those links, provide those opportunities, and start to, you know, bridge those gaps that have occurred otherwise. I want to ask, because obviously we're predominantly an MSK audience on this show and beyond, Andrew, what can the pools do for MSK specifically?
Oh, I mean, Ben's probably, you know, in terms of his background, is probably better qualified to say than me from an evidence point of view. But I know there's really strong and promising evidence in terms of just the specific benefits to MSK and osteoarthritis and other conditions as well, that can be had by getting in the water. And I think the water has some really specific benefits in terms of, you know, physiological benefits, you know, the buoyancy of water, being able to, you know, the resistance of water, even hydrostatic pressure can be a real positive thing in terms of people's physiology and how they react. So I think there are some really unique aspects. And just going back to those case studies again, you know, I think there's some examples you may have seen, the We Are Undefeatables campaign as well. We've had some campaigns around it. Specifically, the Swim England have led on and operate a campaign around love swimming, the hashtag Love Swimming campaign, and there's been some really important examples in there in terms of people who, with arthritis, with other conditions, where weight-bearing activity just isn't an option, or it isn't possible, or it is just too uncomfortable and too painful to perform. And so there's some real obvious target groups. The intuitive benefits, you know, a lot of people will understand and think, well, yeah, it just makes sense that certain individuals will benefit from water more than exercising on land or exercising at home, whatever that might be. But I think also it's not just about, you know, the modality and the chemistry of water, or whatever you want to call it. It's not just the environment itself, but it's actually, you know, for those who are isolated, you know, and so on, being able to leave the home, to be able to go somewhere and perform a positive activity like swimming. There's a whole load of social benefits that come with that as well, and community benefits that come from people being out in their communities and engaging in those types of things. They're not just health and well-being specific. There's a lot more to it.
Absolutely. Paul has said the ability to offload someone in water gives so much confidence, and they can see and feel, and the ability for them to you know, even just range of movement and strength benefits that they hadn't really noticed, and exposing them to that opportunity is massive. Now, one of the reasons I went to you first, Andrew, rather than Ben, is mainly because it would take a 3-hour podcast for me and Ben to get stuck into that. You know, this is Mr. Good Boost, and someone that could lend his hand to various different things, and we're fortunate that he's chosen to pursue this thoroughly. Go on, Andrew. Sorry, you were going to say?
I think I mentioned the intuitive benefits, and I think people understand for some reason, for whatever reason that is, and it might not even be from past experience.
Right.
But our insight suggests that even, you know, 1 in 3 people with a health condition or disability, long-term health condition or impairment, would prefer water and would prefer to opt for swimming as opposed to other activities. And that's a significant data set in terms of the insight that we've gathered over the years. So we know that people with health conditions would lean towards water as a modality, for whatever reason that might be. It might be childhood experiences. It might be more recent. They may have been swimmers, but they may not have. But there's just something intuitive about water, that it's a supportive environment compared to other environments as well. So.
And sometimes the vulnerability you feel, where the last thing you want sometimes when you soar is something fast moving, and sometimes to some extent there's something to be said about the supportive nature and comfort that comes from the hug that water can give in the right context. Now, Ben, we're out of time unfortunately, mate, but give us your elevator pitch to MSK professionals as to why they should be considering aquatic therapy, let's say, or just generally making sure that they get in touch with their facilities as things open back up.
Yeah, from all the evidence, it shows that as a form of rehab compared to land, it is and in many cases more effective for a lot of MSK conditions. But ultimately, it's like Andrew said, for a huge number of people, being in water is low impact, low pain in a way. I think my internet's got. Is my internet still there?
Oh, no, we got you.
I froze there.
Our audio is good, yeah.
It's low impact, low pain, and so the critical thing for anyone with a health condition is that they find an activity they feel they can take part in. For a lot of people, being in water is something they can do where they couldn't do it on land.
Absolutely, that's brilliant. Thank you very much. And Paula, you're a swine. I told you, don't get all the great questions out as we're out of time. That's what I begged of you at the start. But you're making some lovely points and some good questions, which will no doubt then inspire our future shows. So thank you for your participation, even though I just called you a swine. Join in tomorrow. Now, I'm just gonna wrap up on this. I feel like one of the things I'm really looking forward to when I think about the future of this and future conversations, perhaps in this direction. Thank you so much, Andrew, for joining us. But I know as a professional, there's been times that there's been barriers to entry for me to sometimes be the perfect person that could then, for want of a better term, metaphorically hold a patient's hand to take them to the pool, to work with them on that, to bridge the gap between their or to extend into self-management, their rehabilitation. And sometimes the various different, it varies, of course, from facility to facility, but it definitely is something that has been a barrier for me to be able to do. And sometimes I've therefore needed to hand that over to sometimes, even with the best will in the world, the plucky lifeguards then trying to help someone out there, and it's therefore broken down. And unfortunately, that patient's then ended up bouncing back into us, and we're struggling to make that bridge. Is that something, I know it's a tough thing for me to wrap up on, but it's just something that I hope we can have future conversations as to how we can further bridge that gap and work with you potentially to try and make sure that accessibility is very thorough.
Yeah, I mean, we've done some work with Activity Alliance as well recently in terms of developing some of the softer skills of professionals in facilities as well. So one of the projects that we focused on with in terms of access to facilities, to pools, really emphasised that element in terms of inclusive customer experience, training and awareness in the whole facility team, so that it wasn't just individuals, whether it was the swim teacher or the swim coordinator, it wasn't just them who benefited from having all the knowledge and understanding and being able to empathize with individuals. It's, we've emphasized that it needs to be reception staff, it needs to be everybody involved in the running of that facility needs to understand and being able to put themselves in the shoes of someone with a health condition, what they might be facing, what barriers they might have, the nervousness that they feel as they step through the door for the first time, and being able to understand that. So yeah, we're working on that in terms of, and there's other work going on that Sport England are commissioning, UK coaching as well, in terms of the softer skills that are required to be able to facilitate entry and support people.
Oh, that's fantastic. Well, thank you so much, gents. Really appreciate it. Now, I'm going to be brave and I'm going to actually try and play one of the videos and see if it works, because if it doesn't, then we've done the show anyway. But join me tomorrow. I'm with Dr. Ellie Summers. She's going to be doing one of our 3 shows this week, which is in and around International Women's Day. She's going to be talking about women participation in sports and exercise medicine and roles in elite sport. So for now, though, that's enough from us. Thanks a lot, and I'll speak again soon.